This week we're talking about spinal stenosis, and this is a condition that affects lots of older adults, especially over 55. It's an advancement of arthritic changes. These arthritic changes can happen in the facet joints right here, and when that happens, the nerve root that comes out gets irritated. It gets worse with standing and walking. So it's that pain that comes down your leg increasingly as you're on your feet. It can also happen at the ligament that runs along the backside of the vertebral body right here. That can cause the same exact symptoms, but usually it's down both legs. Now they're both going to do better with sitting, with bending forwards, and they're going to do worse with standing. The hallmark sign of both of these is that your walking tolerance is a heck of a lot better whenever you're leaning on a grocery cart. So if you've got that key symptom, I automatically think that this is a stenotic case until proven otherwise. And I'm going to take you through a few drills that we utilize to help kind of open up the spine. Usually these are flexion based. As we bend forward, it helps open up that joint space for the arthritic back. And there's some things that you can do at home to help keep the momentum going while you're in therapy and after you're released from care. I'll show you those. So first we want to just crouch back as far as you can.
Cool.
Yep, so bring the hips back towards the heels, good. So we're working on some hip flexion right here. And as the tailbone kind of lengthens right here, we get this opening up of the facet joints, the arthritic facet joints right here that's causing the stenosis. Okay. And then we're going to work on the rest of it by finding a little more of a neutral posture. So I'm going to arch you down right about here, good. And then we want to address the kyphotic spine right here. We're going to put some extension in the mid-back. So as this head lifts, good, we want to arch this downwards a hair. There you go.
Head. Okay.
Good. And then give me good pressure right here as you pull the floor. So pull the floor with your arms. There you go, good. And then breathe into my finger here. We can rock back to make more flexion in the spine. We can lift the face and combine that with some thoracic extension. Pull the floor, and we get that abdominal contraction as well. Yeah, exactly. Good clunk right there. Good little movement there. Good. And as we lift the face, let's lift the collarbone right here a little. Right there. Good. Hold there. Squeeze the floor right here. Good. Breathe here. Now don't let me pull you backwards. Good. Whenever I start doing this, we get a little bit of traction on the low back as well. This position is not great for all stenotic spines, especially if they got bad knee problems. That can limit them from going into this kneeling posture. But we hit a lot of the requirements too. Come back down and relax. We get that active thoracic extension or start to work towards it a little bit. Lift the face again, right there, good, hold there. We have that intra-abdominal pressurization right here as he pulls the floor. He's trying to pull the elbows back this way against the mat, good. So we get that core activation, which can help cause the low back musculature to be quite soft. If you can see that, it's quite soft right there. Good, come back down. I'll use the percussion tool here to do some soft tissue work along the low back, and it does help kind of drive that thoracic extension right here. Again, with the stenosis, it's about moving extension out of the back and getting more extension up in the mid-back. Okay, good. Lift the face. Good. Try to arch this downwards. There it is. Good. Hold that position and breathe. Good. And then drop down on your. Good. And then we'll grab both knees and bring them up. Okay. Good. 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 Hold this position here. Let's go no hands.
No hands.
Hold there. Good. Good. Here we're just working on intra-abdominal pressure and breathing into my hand. Good. So having to use the core musculature to hold the legs up, not using the spine to hold the legs up as much. And then being able to hold the position here and breathe into the belt. This position transitions into another good stenotic exercise, which is pulling the knees up towards the chest. So we're going to bring the knees way up into the shoulders here. Good. And just kind of grab on here. And we want to do like a pistoning motion of it where we're going to pull inwards and then let it come out and pull inwards and let it come out. We can pump the low back in some flexion right here. Pulling the knees towards the shoulders, not towards the chin, but we want to embrace the wide hips. In the office, I like overpressure by pulling it like the tailbone. Good, let it come out. Good, and pull back in. Good. And you can see my overpressure trying to make a little more flexion in the spine. Again, opening up those facet joints. I'll show you on the skeleton. Whenever we flex the spine like this, you can see the facet joint kind of opening up right here. And that motion can be really therapeutic for a stenotic back.